How will the return to face-to-face classes affect the country's fight against COVID-19? OCTA Research Fellow Guido David joins us on the program. Good morning, Professor Guido. Let's get right to it. What is your take on this proposal to have a return to classes limited to some areas and in the level of higher education?
Well, yes, good morning, Ria. We're actually, I personally support or I'm okay with having resuming classes in low risk, very low risk areas. And we can identify these areas. Usually they are not metropolitan areas around the Philippines, and outbreaks rarely happen in these areas. And if they do happen, they are managed easily. Studies, science has shown that the younger the children, the less the risk for transmission. Now, I also agree with Dr. Edsel Salvania. Of course, if something doesn't work, then it's like an experiment of sorts. Then we should be able to recalibrate quickly and not allow things to escalate before it gets out of hand.
All right, so far the recommendation is to resume classes in higher education levels. Do you see this happening at the elementary level or not just yet?
Well, I mean, I would actually be more in favor, with the elementary level, because younger children tend to be less of a risk for transmission. At least that's what the science is telling us. Now, in higher education, this could pose some problems because older students will tend to need more mobility, or they tend to move around a lot, and it could cause increased public transportation capacity, and that may lead to community transmission. Now, if it were tried in areas with low risk of transmission, then I think I think they could try it. But I echo what the CHED secretary said, the Professor De Vera. I think it's not required for higher education. So I think maybe some higher education institutions could have it face-to-face classes, but not all.
Right, and it wouldn't necessarily be required. So if it does indeed happen and it is allowed, what should the schools do to protect the students?
Well, I think they're trying to calibrate their setup, but definitely students would have to practice social distancing, wear face masks inside classrooms. They would have to be conscious of sanitizing the environment, and of course, I know it's hard to teach in classes where the temperature is quite warm, but they would have to do more of an learning inside open ventilated areas. If I were to teach, for example, outside the classroom, outdoors, the risk would actually be very, very low. Of course, like I said, part of the risk is when students move around, they commute, they ride public transportation. That would increase mobility significantly. But when in the classroom, open air facilities, these would lead to minimal risk of transmission.
Right. In a traditional classroom setup, just how contagious does the disease actually become? How quickly could it possibly spread?
Mm-hmm. Well, what we know is that if you are in a room for a long, let's say you're in a classroom and there is one COVID case there, and everybody's wearing face masks. But let's say it's a closed room and you're in there for 1 hour. The risk would be more significant if, let's say, people were talking. So, and then, if the room is poorly ventilated and air is circulating around. But the longer you are in the classroom, the higher the risk becomes. So the shorter the duration, the less risky it is for everyone inside the classroom. So long classes would be very, very risky. Like, I mean, for example, a 3-hour class would pose a higher risk, especially if someone were not wearing a face mask or face shield effective appropriately.
That's right. Okay, thank you so much for your time this morning. We do appreciate it, Professor Guido David from OCTA Research.